Hi everyone, I am Gauri PS, lecturer, Department of Radiology, Global College of Allied Health Sciences. Today we are going to discuss about the topic fluoroscopy. So what we are going to look is about, today's objectives are about fluoroscopy, its principle and its components and its applications in, and also about the radiation protection which we follow in our fluoroscopy department. First is about introduction. So, what is actually fluoroscopy? The fluoroscopy is the dynamic imaging technique that uses the X-rays to produce the real-time images. That is, the live images can be captured during the fluoroscopy procedure. So, what is the definition is about? It is an imaging technique which uses the continuous or pulsed X-rays and produces the real-time images. Usually, the fluoroscopy is a method, that is, by obtaining a radiological image in a fluorescent screen or phosphor. Actually, this imaging procedure will be giving the live X-ray image of the patient and it is obtained the real-time moving images of the internal structures of the patient by the use of a fluoroscope. Usually, the fluoroscope is a dynamic imaging technique where the radiologist view the images of the moving organs continuously while the X-ray beam is on. And this real-time imaging will be requiring 30 frames per second. That is similar to that of the television technology. That is, this will be facilitating the movement of the organ over a period of time. So, fluoroscopy imaging possesses high temporal resolution. Since this fluoroscopy will be a dynamic process, the radiologist must be adapting the moving images even though the images are dull. And this requires the knowledge of the imaging illuminations and also the visual physiology. Next is about the history. In 1895, the X-rays were discovered by Wilhelm Conrad Röntgen. And next, they led to the development of this imaging intensifiers and digital system. That is, this fluoroscope was mainly made in the year of 1896 by Thomas A. Edison, who was the first to discover about this fluoroscope. Then it is about the principle. What is this principle? Usually, this fluoroscopy is that it will be these are the X-rays which will be viewed lively by the radiologist and also the technologist. That is, the X-rays when they pass to the patient's body and it will be receiving to the detector and we can view it in the monitor. And there is also a fluorescent screen where we can view the live moving of the internal organs of the body. The next about the what is the construction of a fluoroscope? Usually this fluoroscope consists of an image intensifying tube. That is, first it consists of an X-ray tube and in between there will be patient and next there will be an image intensifier and next it will also have a TV camera and then a monitor for viewing these images. Actually, this image intensifier is kept in an evacuated glass envelope that consists of basically 4 elements. That is, an input screen, focusing electrodes, anode and output screen. Usually the patient side of the vacuum bottle will be having an aluminum window which will be curved in one side to withstand the air pressure, and this evacuated glass envelope has a limit of the size of the image intensifying tube and its diameter will be ranging from 23 to 57 centimeter. Usually, the field size can be reduced electronically by using an electrostatic focusing and the glass envelope is mounted inside the metal container which will avoid the damaging and rough handling. Then this X-ray tube will be producing the X-rays continuously or by means of a pulses, and this X-rays will be used for the imaging of the organs very much clearly. Next is about a high voltage generator. Usually it supplies the power and controls the exposure factors properly. Next about the patient table. The patient table is made up of a radiolucent and it has a capability of tilting over different angles. Next is about the image intensifier. An image intensifier is an instrument that will be converting the X-rays into the bright visible images which can be viewed by the radiologist and also the technologist. Then the construction of an image intensifier. That is, it consists of input phosphor, photocathode, focusing lens, anode, and also an output phosphor. This input phosphor is made up of an cesium iodide crystals, and it also has an input screen which is made up of an aluminum window, and there is a photocathode that is convert the light photons into electrons, and it is made up of zinc cadmium, and that is zinc cadmium sulfide. The next is about the electrostatic focusing lenses. That is, it helps to focus the electrons beam over the particular area so that we can produce a large amount of X-rays. Next is about the accelerating anode. That is, this anode will be accelerating the electrons which will be coming towards it and will be helpful in the generation of a large number of X-ray output. Then output phosphor, it will be producing the bright visible images so that we can view very clearly, and this output phosphor screen is made up of zinc cadmium sulfide which is doped with silver. That is, a backside screen is with aluminum so that it can absorb the electrons and it will be emitting a green light. The next is about the brightness gain. That is, the brightness gain is defined as the ratio of the brightness of the output phosphor to the brightness of the input phosphor. And the brightness phosphor can also be written as brightness phosphor is the product of the flux gain into the magnification gain. That is, the decrease in the size of the image. That is, flux gain into a magnification gain. Usually there are three types of fluoroscopy, that is about conventional, continuous, pulsed, and also about a digital type of fluoroscopy. Usually this continuous fluoroscopy, it is made up of a continuous X-ray production over a series of time, and pulsed fluoroscopy, it produces the reduced radiation exposure and produces the images in a pulsed manner. Next is about the digital fluoroscopy, and it will be providing the better imaging quality and also storages. Next is about the flat plan detectors. The flat plan detectors are made in replacing these image intensifiers, as these flat plan detectors are much useful than these image intensifiers. Next is about image recording methods. Usually the image recording methods consist of spot films, cinefluorographies, packs, etc. Usually this application consists of, this fluoroscopy method is applied in cases of barium swallow, barium meal, barium enema, angiography,